Hi guys, welcome to my channel and learning together. I hope all are doing fine. So, as I have discussed in my previous video about heparin, I hope you have seen that video. Then only you will be able to understand this one, which I am going to start today. So please go and check out that video. And if you do like my videos, please subscribe and like those videos and hit the bell icon for quick notifications. So yeah, let's begin. So today we will be discussing about LMWH, that is low molecular weight heparin. So low molecular weight heparin comes in different formulations are there, that is zero point 0.4 ml, 0.6 ml, like this. So in this picture you are able to see that is 0.6 ml, that is 60 mg per 0.6 ml. So these are all pre-filled syringes which are there. Okay, and I want to ask you a question, and that I will answer at the last part of my video. So what is the reason behind this air bubble in this pre-filled syringe? Why it is there? So please think about it and answer in the comment section if you know. And but I will answer it in the last part of my video. Okay. So let's begin. So coming to low molecular weight heparin. So low molecular weight heparin comes in different brand names like Enoxaparin, Dalteparin, then Tinzaparin, Ardeparin, Reviparin. So different brand names you will see. So but in LMWH, as the name suggests, low molecular weight heparin. So it has a low molecular weight as compared to unfractionated heparin. Okay, so it is around 4,000 to 7,000, and heparin was more than that. Okay, 10,000 to 20,000, like that. Coming to the mechanism of action, LMWH has a different anticoagulant profile. Like as I have told you in heparin, the mechanism of action was like it indirectly inhibited thrombin. Means its action was mainly on antithrombin, which caused the inhibition of thrombin, and thrombin was used to uh, activate other factors also. So it mainly acted on thrombin and other factors as well. So indirectly or directly. So it caused the anticoagulant effect. Whereas in LMWH, what happens? It selectively inhibits factor 10A with little effect on 2A. 2A is factor 2 is thrombin. Okay, that is prothrombin, which gets converted into thrombin, that is 2A. So it selectively inhibits factor 10A and little effect on 2A. So thrombin is a very important factor in the activation of other coagulation factors, as I have shown you in a picture about the coagulation cascade in my previous video. So here what happens in LMWH? LMWH causes only a conformational change. It causes a structural change in the antithrombin 3, and not any interactions occur between this LMWH and antithrombin 3 with thrombin. No such interaction. As I have shown you in heparin, there was interaction of antithrombin 3 with thrombin, and thrombin gets inhibited, then other factors also gets inhibited, due to which there is a change in the intrinsic pathway. Okay, the intrinsic pathway gets prolonged. So therefore the APTT gets changed. Whereas here it does not happen like that. Only factor 10A gets inhibited and little effect is there on 2A, because there is only a structural change in the 83, which causes which does not cause any kind of interactions with the thrombin. So therefore the coagulation is very means the anticoagulation effect is very smooth. As a result, we don't need we have means there is no need of any look for checking the APTT values or the whole blood clotting time as compared to that in unfractionated heparin. So unfractionated heparin had a stronger coagulation effect as compared to LMWH. LMWH also has a coagulation effect, but it is for a longer duration. Okay, it is very smooth. Whereas UFH gives coagulation at a very higher levels. Okay, and it also has lesser antiplatelet action. As I've told you, heparin used to stick with platelets and causes thrombocytopenia. Okay, heparin induced thrombocytopenia, but LMWH has no such action, and major bleeding is not there in case of LMWH. Okay. Coming to the indications, same indications, LMWH based upon the condition of the patient, we give LMWH or heparin. Okay, for DVT prophylaxis. Prevention and treatment of venous thrombosis, pulmonary embolism, high risk patients who are undergoing surgery such as stroke or other immobilized patients. So that also we should look for carefully. If the patient is on any antiplatelet drugs, we should avoid it, but if it is necessary, then we can start it at a low dose. Unstable angina, and to maintain the patency of tubes in dialysis patients. So in sometimes in dialysis patients we need to do hep lock, that is heparin lock. So in those cases LMWH can be used or heparin lock is used. So based upon what the doctor's order is, so we can do it. And in CABG surgeries, that is coronary artery bypass grafting, we use UFH is still preferred over LMWH because UFH is a higher anticoagulant action and is more effective as compared to LMWH in preventing thrombosis. Okay, and if there is a bleeding, if there is an overdose of UFH, we can also reverse it by its antidote, that is protamine sulfate. Whereas in LMWH there is no such antidotes are present. Okay. So this is the dose of unfractionated heparin, enoxaparin, dalteparin in case of thromboprophylaxis. As I have told you, in unfractionated heparin, we mainly give around 2,500 to 5,000 units. That is subcutaneously every 12 hours or 8 hours. Means TDS dose or BD dose we mainly give because the duration of action of heparin is low as compared to LMWH. But LMWH you might have seen that daily we give, but OD dose is given because its duration of action is longer. So in my next video I will compare both heparin and LMWH, so you will be able to understand more clearly about it. So you can see the dose of enoxaparin 40 mg or 30 mg twice or once daily. Okay, based upon the dose. If the dose is less, then you have to give it twice daily, but if the dose is more like 40 or 60 mg, you can give it once daily. OD dose. Obesity, in obesity you need to give a higher dose, obviously, if the BMI is more. And renal failure, you have to give low dose. Okay, you have to see the creatinine levels and the urea levels, then only you need to give LMWH. Dalteparin, that is the usual dose, is around 2,500 units SC once daily or 5,000 international units. In renal failure, there is no recommended dose. Advantages over heparin. So what are the advantages that we get in LMWH as compared to heparin? So that is better bioavailability following SC injection. As I've told you, when heparin is given in through SC, there is a inconsistent bioavailability is there. But in case of LMWH, it has been seen that it has a better bioavailability when given by SC injections. It has a longer duration of a longer action is there, around 12 to 18 hours you will get the effects, whereas heparin you will get only for 2 to 3 hours its effect is there, so you have to give frequent doses has to be given. Then lower risk of bleeding is there because of less interaction with platelets, so thrombocytopenic chances are less. And also the effect of LMWH, that is the coagulation effect, is also less. Then lower risk of osteoporosis is there, lower incidence of thrombocytopenia as I have told, and thrombosis, and routine lab monitoring of APTT is not required. So why it has these advantages? This is because LMWH which is there, it does not bind readily to the plasma proteins or endothelial cells or macrophages or platelets like unfractionated heparin. So because of this, LMWH gets all these actions, means advantages over heparin. So this is the main um, advantage that gives LMWH, its advantages over other UFH. Coming to this table, so this is a very important table. You should by this only you will be able to know what is the difference between standard heparin and LMWH. I'm sorry, I have underlined this with pen. I have taken the picture from one book. So coming to the molecular weight, as I've told you, the molecular weight of unfractionated heparin is around 10,000 to 20,000, whereas LMWH is around 4,000 to 7,000. Okay. Source is mainly natural or semi-synthetic. LMWH is semi-synthetic. It's just chemical treatment of standard heparin. Means heparin is further broken down into LMW for making LMWH. Whereas heparin we extract it from either porcine intestine or from other animal intestines. It is mainly produced. Then thrombin activity in therapeutic doses, in heparin it is inhibited, whereas in LMWH it is not inhibited. Effect on test of clotting, it is significant. So clotting is there. Now means clotting is decreased in case of heparin. So we mainly see the APDT and the bleeding time, clotting time, all this. Whereas in LMWH no such uh, monitoring is needed. Lab monitoring is required in heparin, whereas in LMWH it is not required. SCA bioavailability is low in standard heparin, that is around 20 to 30%, whereas in heparin it is high, that is 70 to 90%. Duration of action is around 2 to 4 hours. Okay, in heparin it is 2 to 4 hours, whereas in LMWH it is around 18 to 24 hours. Okay, it is a longer duration of action because, as I've told you in my previous slide, that LMWH does not bind to any macrophage or endothelial cell or any platelet. So its duration of action is longer as compared to heparin. Then frequency of administration every 4 to 6 hours, and LMWH once a day is enough. Dose dependent clearance, yes, based upon the dose it has to be cleared from the body, whereas LMWH has no such effects, no such clearance is needed. Thrombocytopenia can occur, whereas in LMWH there are lesser chances because it does not bind to platelet and cause thrombocytopenia. Then risk of bleeding, in standard heparin the risk of bleeding is more, so because it inhibits thrombin, whereas in LMWH it is lower because it does not has effect, it selectively inhibits only factor 10. So the risk of bleeding is less as compared to that of heparin. So I hope you understood the difference between LMWH and heparin, because for some students it is very confusing about what is heparin 1, what is LMWH, what is the difference between them. So I hope I was able to explain the whole thing about LMWH and heparin. So please go and read this table, it is very important. Coming to antidote of heparin, for LMWH there are no antidotes, whereas for heparin antidote is there, that is protamine sulfate. Protamine sulfate is a protein which is obtained from the sperm of a particular fish, and it is given intravenously and it neutralizes heparin. So 1 mg of this protamine sulfate is enough to neutralize 100 units of heparin. So in the absence of heparin, protamine can itself act as a weak anticoagulant. So you should be cautious enough while giving protamine as well also. Okay, you should not give protamine like that. Only when there is a heparin overdose is there, then only you should go for protamine sulfate. Hence, overdose should be avoided. It is strongly basic, which binds with strongly acidic group of heparin, following a stable complex which does not have anticoagulant activity. So the anticoagulant activity of heparin is reduced when you are giving protamine sulfate, and it is used when heparin action needs to be terminated rapidly. Okay. So this is the antidote of heparin, protamine sulfate. So 1 mg is used for 100 units of heparin. So this was all about LMWH. So I hope you were able to understand the difference between LMWH and heparin. the mechanism of action, the molecular weight, the duration of action, why LMWH has a lesser anticoagulant effect as compared to heparin. Okay, so in the beginning of the my video, I have asked one question that why the air bubble is present. The air bubble is mainly present because it acts as a seal. So when you are giving the SC injection to the patient with that pre-filled syringe, you should not push out the air because it acts as a block for the medicine so that it does not come out. Okay, so therefore that bubble should be present, and while giving it to the patient, you should inject it into the subcutaneous tissue. So yeah, was all about LMWH and heparin, the difference. I hope you understood. So if you have any doubts regarding this video, please feel free to ask questions in the comment section. And yeah, please like and share with your friends who needs it, and do subscribe my channel and press the bell icon. Okay, have a good day. Thank you.